Coming up next on Arizona Horizon, the governor has declared a state of emergency because of our opioid epidemic. And we'll talk city issues with Chandler Mayor Jay Tibshraeny, including how cities fared with lawmakers this past session. That's next here on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Arizona PBS, members of your PBS station. Thank you.
Good evening and welcome to Arizona Horizon. I'm Catherine Anaya in for Ted Simons. Governor Doug Ducey on Monday declared an emergency to deal with Arizona's opioid epidemic. That came after a report showing overdose deaths from opioids up 74% in 4 years. As part of the emergency declaration, the Arizona Department of Health Services opened a Health Emergency Operations Center. Tyler Fingert was at the center as it launched.
This is going to save lives.
New urgency in the fight against opioid overdoses.
We're hoping to make an impact on it with some quick, decisive action.
At the Health Emergency Operations Center in Phoenix, this is what they've been prepping for.
Every situation has a focus. This one being opioid is new for us.
The Operations Center is a statewide multi-agency coordination center with a goal of protecting the public from health threats.
The suspected opioid overdoses.
The state health department has been looking at the opioid problem for a while, but without reliable data, it's been difficult to track.
We don't have great data on opioid deaths. Our opioid death data can lag a year behind. And so we noticed in October we were still updating deaths that occurred in January.
The health department is taking a look around the country, looking to other states for the best way to handle the problem, with a goal of making Arizona just as good or better.
I think every state is in a different spot, so I don't know that we have catching up to do. I think the entire nation has been impacted, and some states have best practices. In Arizona, we have some best practices, so that's why it's so important to do that 50-state crosswalk.
This is the first statewide public health emergency in at least 10 years. Here with more on what the state will do to combat this epidemic is Dr. Kara Christ, director of the Arizona Department of Health Services, and Scott Summers, a former Mesa City councilman who was a contributor and signatory to the Johns Hopkins University School of Public Health document, The Prescription Opioid Epidemic. Thank you both so much for joining me to talk about this very, very critical issue. We're talking about more than 2 people a day dying from prescription opioid or heroin overdoses. What exactly, if you can break it down for us, is this state of emergency intended to do?
So this state of emergency is intended to focus the public health system on this epidemic, just like we would an Ebola or flu outbreak. So getting public health data that is real time, that will be able to target communities and give us information about what interventions to implement in those communities to save lives is one of the major points of this declaration.
Well, and it's long overdue. We're looking at a 74% surge just since 2012. Could the problem actually be even worse, and maybe it's just underreported at this point?
It could. Part of the problem we're having in tracking a lot of our medical issues, but particularly this one, is that our data sets don't often talk to one another. So there's some fairly decent data coming out of emergency departments, for example, that talk about the scope of this problem. But where it's not connecting necessarily is with emergency medical services. Community paramedics are providing healthcare services in the field and are able to counteract these overdoses, and those may not make it back to the state. So this could be a very underreported problem.
Well, and you know this firsthand because you're a paramedic. What are you seeing out there on the streets?
We're seeing a significant rise in the number of overdoses and overdose deaths, not just in Phoenix, but nationally as well. And what's driving that are prescription medications for pain. Oftentimes people will get these prescriptions, they won't fill them out, they won't complete them, and then they sit in the closet, and oftentimes they're used for non-medical reasons, either shared with friends or they're taken by family members and abused.
And the problem here also is that people obviously aren't taking these intending to be addicted. They become addicted, and it becomes a gateway to what we're seeing with these heroin overdoses, right?
Right, absolutely. So most people believe that this is prescribed by a doctor. It's safe, and we underestimated the addictive potential of these medications and how deadly they can be. So what we really need people to understand is that these are medications, they are dangerous, they are addictive, and they can have deadly consequences if taken in combination with other medications such as benzodiazepines, Valium, Ativan, or if you take too much. And so people don't take these medications. They're looking for pain relief, and they don't understand that it can be dangerous.
When you talk about the people this is affecting, who specifically are we talking about? Specific age group?
This is impacting our entire spectrum, but surprisingly, our highest number of deaths is in our 35 to 65-year-old age group. And so a lot of people think that drug overdose is seen in the younger ages, and we are seeing this in our middle-aged population. And there's probably a variety of reasons why that is. We just don't have great data right now to be able to help target interventions.
Well, one of the things that this declaration will do is help to better manage the numbers, the cases that are being reported. Will it also help people get better access to treatment?
Well, that's certainly one of the hopes, and the community solutions is really focused around identifying the problem, helping people recognize when they have a problem, and then connecting them to the help that they need. So the fire department is a great place to start because paramedics who see this every day, and here in Phoenix we're fortunate to have a lot of folks who work on what are they're counselors that work with the fire department. So first responders can contact those folks and they will help you get in touch with drug addiction programs to help with this problem.
Well, you've been at the forefront. In your personal opinion, what do you think is contributing to this epidemic?
I think it's a combination of factors. I think part of the problem is that people who are prescribed their medications don't necessarily maintain control of them, and when they're done with them, they're not disposing of them. Almost every city right now has a disposal program, either through the fire department or certainly through the police department. You're starting to see these every day in some of the drug stores where you can take your prescription medications back. So I think it's availability, but there's also a problem of overprescribing. We've seen things like fentanyl is extraordinarily dangerous to first responders. It is readily absorbed. Just recently we've seen some police officers in Ohio that were accidentally exposed to the powder and they had overdose reactions. The prescriptions for those went up 222% between 2000 and 2007.
That's incredible.
That's an incredible number, and it's a very potent drug, but it's a necessary drug. There are people who have surgeries and chronic pain that have to be managed, but when the drug gets out on the street, it becomes a hazard to children, but a hazard to first responders as well.
Well, so will this declaration also make it so that there is a limit to how much of this can be prescribed by doctors?
So one of the directives that Governor Ducey gave to the department is to develop recommendations for him to take forward. We're not at that point just yet, but we will be working with stakeholders and partners to determine what are the best practices and what are the evidence-based practices.
And I want to present this question to you as well. What do you think is contributing to this issue? Because I know we talked about it's a number of things, but any other things besides what Scott mentioned?
You know, I think that as one of the things that we need to be careful as a medical community is each stage needs to be dealt with in a different manner. So you want to prevent those that have never been on opioids from becoming addicted and introduced to them. Those that are on chronic opioids for chronic pain and have been on for a while, you don't want to cut off their supply. They need that medication. They are used to the medication. So you want to work with them to understand how to use it safely and potentially how to wean them off. When you cut off the supply, that's when you drive people to the illicit forms, such as heroin, because we know 80% of heroin users started as prescription drugs, and there's no regulation of heroin or illicit drugs. So you want to keep them safely monitored by the medical community.
What can you tell me about the overdose drug Narcan, and how will this declaration help get that drug to the people, the communities with those high numbers of deaths and overdoses?
So Narcan is the overdose reversal drug. So you can give it to somebody who's overdosed, and it can revive them long enough to get them to medical care at an emergency room. And that's really what you're trying to do to save lives. The declaration does direct the department to get Narcan or naloxone into the community. So we are actually going to be purchasing naloxone for law enforcement, for first responders, for public health, and the community. And then educating the community. If you have a loved one, you can go to a pharmacy, you can get it without a prescription, you can get it from your doctor, have it on hand, know the signs and symptoms of overdose, and know how to administer, because you could save your family member or loved one's life.
Is that going to make a difference, Scott?
It can make a tremendous difference, and particularly for emergent incidents of overdose. And I have some Narcan right here. It's very safe. So the medication works on your nerves, and it holds on to receptor sites on the nerves. And what this does basically is it just kicks it off. And if you have too much of an opioid, it stops you from breathing. So by using this drug, you start people breathing again, and that's what saves their life. The good thing about Narcan is it's extraordinarily safe. So you could take this right now and it will have absolutely no effect on you. So, and as you see how I have this one set up here, we can put this in someone's nose and it's readily absorbed, and it has the proper effect without having to use a needle. So this is the type of thing we're hoping the governor will take a look at, and possibly not only to make it available readily, but also encourage physicians who are prescribing opioids for pain relief, perhaps to teach family members how to use this medication in case of an accidental overdose.
Do you think that'll make a big difference, Doctor?
I think that will make a big difference, and that is one of the recommendations that we are going to be making to healthcare providers. We're also working on hospital discharge guidelines to ensure that those that go into a hospital for an overdose, we hook them up with peer counselors, we get them into substance abuse treatment if they're ready, but they walk out of the hospital with a filled prescription of Narcan and know how to use it, because that's what's going to save lives.
Well, and would the move be to get pharmacies to be able to give this out without a prescription? I mean, is that the idea?
Yes, so legislation was passed that does allow pharmacists to dispense without a prescription. So somebody can go to a pharmacy and say, I'd like to get Narcan, and they would be able to get it if they could pay for it.
Well, we're certainly going to stay on top of this issue because, as you mentioned, it is a crisis. It really is. So thank you so much for bringing it to everybody's attention, and of course, the governor taking the lead on this. We appreciate you being here. Thank you. You are watching Arizona Horizon. Up next, we'll talk about how the legislature treated cities this past session.
This is the real thing. This is where we were born.
One of the amazing things about the history of life on Earth is it keeps learning new tricks.
The animals, the plants, really gets in your blood.
Everything's interconnected.
We've got to begin to tell a new story. A story about interaction.
It's something that really touches my heart. There's just massive life everywhere. It's just magic.
Welcome back. Chandler Mayor Jay Tibshraeny, who is also president of the League of Arizona Cities and Towns, is here to give us a recap of how cities fared in the past legislative session. And he'll also talk about a dispute over power lines settled between Chandler and SRP. And joining me now is Chandler Mayor Jay Tibshraeny. Thank you so much for being with us. We appreciate it. So let's just break down how the legislative session went so far for Arizona cities and counties. How did they fare overall?
Well, I mean, I would say I felt really good about the way the session went. as the president of the League of Arizona Cities and Towns, and that's all 91 cities and towns in the state, as their president, that's a big responsibility of mine, tracking legislation. So we were very active this year. And to answer your question, I thought it was a really good year for cities and towns for a lot of reasons. I think we were able to communicate with the legislature and the governor. We started out early with some pre-legislative meetings with them. So we were able to, I think, offer good input and good advice and be an honest broker of information, so that if there were bills that we didn't like, here's why, we could present the facts, and we could maybe fix good bills maybe that weren't as good as they should be. And if there was bad bills, you know, we could explain our side, and if we had to oppose them, we would oppose them. But I thought it was a good session. You have to remember, there's hundreds of bills introduced each year, hundreds of bills, and about a third of those this year affected cities and towns. So we as a league have to assess each bill, what's the impact on the cities. It's a lot of work. It's a lot of work. So all in all, good year. We got nicked a little at the end on an election bill, but for the most part, I felt like we were able to have a good relationship with the leadership, both in the House and the Senate and in the governor's office as well.
Well, that's good to hear. Let's talk specifics. You fended off a bonding plan that would have had major implications for the state's 3 public universities and threatened the state's tax revenue over a number of years. How difficult was that?
And what happened on that, actually, the version that ended up ultimately passing is a version we had proposed many months ago. But we were concerned with that the bill as it was initially drafted would take the city's sales tax, transaction privilege tax, and that's a tax everybody pays. We didn't want to start having a Swiss cheese type tax code. So we opposed them using city funds to do the university infrastructure bonding proposal. Once everybody came to the conclusion that we could get this past the finish line without harming cities and towns who are tremendous partners with our universities, we love our universities. So we were able to get people, I think, to see our side of things. There was a little push and take all along. But that bill did ultimately pass without affecting in a negative way adversely cities and towns. So we were happy with that. That worked out well, but it was contentious at times, but we worked that one through. So that one got done, checked off the list.
And how about counties dealing with the costs that were shifted from the state during the recession? How's that being handled?
Well, you know, one of the city's big thing has been the HERF sweeps, and the highway user revenue funds, which are usually supposed to be used for highways, but there's been significant shifts to help fund DPS. But the last couple of years, actually, the legislature's made inroads into not sweeping as much. The net effect being, instead of sweeping 100 million, they're sweeping 80 million. We want the DPS to be funded through the state general fund. I think the legislative leadership in the governor's office, my understanding, that's the direction they want to go. So we're seeing those sweeps minimized the last couple of years with a commitment to get all of those funds coming out of the general fund and to have HERF go to the cities and the counties and the towns like it should, and the state itself. So that one, again, I think we made good progress this year, and I thought it worked out very well for all parties concerned.
So how would you view your outlook for the next session?
Well, every session is different, but one thing I've wanted to do as president of the league is to raise our involvement and to also raise everybody else's awareness that the league is here to work with everybody, the legislature, the governor's office, and we want to be partners and cooperative with them. So I think next year is going to be a good year. I'm optimistic by nature.
We love to hear that.
Yeah. And I think we have a lot of opportunities. We have the same issues, the state and the cities, and so we just need to pull together. But the speaker and the president are both from my district, Chandler. So I'll continue to reach out to them. I've sent a couple of letters in the last week to the governor, one inviting him to come speak to the league's conference, and also one just saying, hey, I thought we had a good session.
Right.
Let's continue to work and make strides and even have a better session next year. So that's where I think we're heading.
Well, let's shift gears for just a moment. Tell me a little bit about this agreement between Chandler and SRP involving the controversy that we've heard about over the proposed power lines in the Price Road corridor.
This is that 4.5-year-old controversy. We've had that. The SRP wants to locate power facilities, power lines, 230 kV, those are the big ones, to help supply power into the Price corridor, according to them. So this has been an ongoing saga for about 4.5 years. A lot of neighborhoods have been affected with lines that were drawn and then not drawn and so on and so forth. And so finally, after 4.5 years, last week, SRP and us came to an accord. Those lines will come down the Price corridor. They'll come down Price Road, but they will be undergrounded. And so we think that that's a win-win situation for neighborhoods that were affected, that would have been adversely affected if those.
Well, and speaking of the neighborhoods, I mean, the neighbors really rallied in opposition of this. They even called themselves the Red Shirt Army. What's been their reaction to this agreement so far?
They're happy. But they knew all along. Myself and the city council supported them, and the last thing we wanted to see was lines by their neighborhood, and we were very unified in that. And so by having the city council unified, supporting the neighbors and the businesses that were also concerned about above ground lines, and also us making our case before there was a formal application with some of the corporation commissioners, and they were sympathetic to the plight that we were going through. I think with that, and then SRP realizing, yeah, let's work this out. And so I'm happy that we were able to work it out with SRP. I think it's for the best, and hopefully it'll be a model on how to solve problems. But 4.5 years is a long time.
Yes.
It's a long time for a leader such as myself to have to deal with one issue, and it's always been a very divisive issue. Power lines become divisive issues. And so solving it and having it off the table is a good thing.
Even if it did take 4 years.
4 years.
It's a win-win situation, as you mentioned.
I think so.
Well, thank you so much for bringing us up to speed on that, Mayor. We appreciate it. Good to have you here on the show. Thanks for being here. We look forward to having you back.
Look forward to that myself.
All right. Thursday on Arizona Horizon, get analysis of the testimony from former FBI Director James Comey about his meetings with President Trump, and find out about a new center at ASU that is helping keep students and staff grounded. That's at 5:30 Thursday on Arizona Horizon. And I thank you so much for joining me. I'm Catherine Anaya. Have a great night.
Arizona Horizon is made possible by contributions from the Friends of Arizona PBS, members of your PBS station. Thank you.
And thank you for tuning in to Arizona Horizon here on Arizona PBS. I'm Alice Ferris. You know, when you watch programs like Arizona Horizon,